Good afternoon, everyone. I am Twinkle Marva, Marketing Head at Advanced Sales Group. It's my privilege to welcome you all to today's enlightening webinar session, Enhancing Neuro-Regeneration, Integrating Occupational Therapy and STEM Therapy. In this session, you will hear about how occupational therapy can significantly improve key development skills in various ways and explore the exciting frontier of stem cell and their neuro regenerative outcomes for autistic kids. Now, without taking so long, I am honored to introduce our esteemed speaker, Dr. Ishika Singh, a senior pediatric occupational therapist with a bachelor's in occupational therapy from Jamia Hamdard University and master's from Jaipur OT College. Dr. Ishika has built a robust 3-year career working closely with children on autism spectrum. Her evidence based, children centric approach focuses on empowering independence, nurturing development, and crafting individualized intervention for each child's unique strength. Thank you so much, Dr. Ishika, for joining us today. Over to you now.
Thank you, Twinkle, for inviting me here as a guest speaker. I'm delighted and honored to be a part of this webinar. As you have mentioned that I have a bachelor's of occupational therapy from Jamia Hamdard, and I have done my master's in neuroscience from Jaipur Occupational Therapy College. So today I will be talking about how occupational therapy works and helps children with autism. Also, I will be discussing about how stem cell treatment and occupational therapy works combinedly to help the autistic kids. Just a second, I'm just sharing my screen with you all. Is my screen visible?
Yes, Doctor.
Okay. So the first topic is, what is occupational therapy? So as we get to we get all this question like what occupational therapy exactly is. So in occupational therapy, we help people to work on cognitive, physical, social, and motor skills. In cognition, attention, working memory, auditory processing, long-term memory, visual processing, logic, and reasoning come. And by physical, we mean balance, coordination, endurance, and strength. And on social aspect, we work on social interaction, good manners, and in motor skills, we work on gross motor and fine motor. So gross motor is basically the long muscles, and fine motors are basically our small joints and small muscles. So the goal is to improve everyday skills which allow people to become more independent and participate in a wide range of activities. And for people with autism, ADHD, sensory processing disorders, OT programs often focus on playful skills, learning strategies, and self care. So, the OT strategies are to help manage sensory issues. We will be discussing about the sensory in the coming slides. So, the first thing which we have to do in to proceed the therapy is evaluation. So, what the evaluation looks at several areas, which includes how the person and the child learns, plays, care for themselves, interacts with their environment. So it's very important to learn about the child, how he's playing, how he care for himself, and how he is interacting with the environment. Environment such as like at home, school, and other places. Also, very important areas to evaluate is primitive reflexes, sensory processing, and motor development. So all this evaluation it helps us to identify is there any obstacles that prevent the person from participating in day-to-day activities, and based on this evaluation, we the therapist we create goals, and strategies that will allow the child to develop their key skills. Now, how an occupational therapist help your child with autism spectrum disorder? So, an occupational therapist for autism helps the child improve the quality of life at home and school. So most of the parents, they come with the complaint that our child is not cooperating at school or at home. So while working with the ASD kids, these are the complaints we do get. So in the due course, we help the child to learn gross motor skills, fine motor skills, perceptual skills. In perceptual skills, it includes differentiating sizes, shapes, colors. Gross motor and fine motor, I have explained. Like in gross motor, we work on the long muscles. For example, setting posture, walking, climbing, or riding a bike. In fine motors, we work on the small muscles and small joint, for example, to do precisely activities, for example, holding a pencil, writing, or opening and closing of items. Also, OT helps your child to learn their body with the relation to others. The visual skills are needed for writing and reading. Also, the kid learns to play, self help, problem solving, coping, and other social skills. A child with autism under occupational therapy learns to develop adult and peer relationships. Also, day to day activities, uh, daily living activities such as brushing, toileting, and grooming skills, and how he express himself, how he self regulate and express his feelings. So, sensory integration. I told you about that we work on the sensory area. So the sensory integration means addition of anything. So like sensory integration will be meaning that one sense is working with other senses as well. Like all the senses are working together. Most oftenly in sensory processing disorders, like if the child is a seeker, for example visual seeker, so he will like continuously like look at the lights, look at the spinning objects, like if the fan is on, so he will always like keep looking on the fan, because that way he is only using his his visual sense, only one sense he is using. He has forgotten, or maybe the brain is not proceeding that there are other senses also which he or he has to like get stimulus. So sensory integration refers to the processing, integration, and organization of sensory information from the body and the environment. For example, I'm here, I'm speaking, I'm looking at my screen. Also, like in my room, there is AC on, so I'm getting the chill sensation also. I'm speaking, I'm looking at the screen. So like all these things I'm able to do because all my sensory system is working simultaneously. Simply, this means how we experience, interpret, and react or ignore the information coming from our senses. So sensory integration is important in all the things that we need to do on daily basis, such as getting dressed, eating, moving around, socializing, learning, and working. So there are total 8 senses. There are 5 classic sense and 3 hidden sense. Hidden sense means like there these senses are present in our body, but like not physically. We can like for example, eyes are there to like for visuals. Our skin is for tactile and auditory, and our ears are for auditory. Our skin is for tactile, and our tongue is for gustatory, and nose for smell. So hidden sense means vestibular is like balancing and movement. And proprioception is like how our muscles are and joints are perceiving the information, and about the body awareness, how we are coordinating in the environment. For example, I'm sitting on a chair, I will get up and I will move around. So all this I'm able to do that because of my proprioception sense. Interoception means the receptors of interoception are present in the internal organs, which are responsible for interoception of signals that provide information of the internal body. For example, emotional state. I'm hungry. I'm feeling sad. Like I have to go. to pee or something. So this is the interoception cells, for which comes from the internal organs. I hope this much is clear till now. Okay, so moving forward, now I will be talking about primitive reflexes. So primitive reflexes is actually a topic which will be requiring a whole session separately. But in this session, I will just give you an overview about the primitive reflexes. What are primitive reflexes and how it affects the child? So primitive reflexes are involuntary motor responses. Involuntary motor responses means that it is it is not under our control. The brain is the CNS is coordinating it internally, which is not the voluntary movement. For example, I'm able to move my fingers, hands, my legs. These are my voluntary movements, which I'm able to do by myself. And involuntary movements are those which are not under my control, my not under my own will. So these responses originating in the brainstem present after birth in early child development that facilitate survival. Serval reflexes are important in the assessment of newborns and young infants. These central nervous system motor responses are eventually inhibited by 4 to 6 months of age as the brain matures and replaces them with voluntary movement activities, but may return with the presence of neurological disease. So, what this line means is that primitive reflexes are involuntary movement. By the age of 4 to 6 months after birth, the brain matures, and these reflexes are replaced by the voluntary movement activities. So, which means they get integrated in our body. If they are not integrated, if they get retained, then there must be some neurological disease or some sensory problem, some motor issues. Primitive reflexes are adaptive response that develop during the neonatal period that integrate over time as the prematures. They are present for survival and development in the early months of life. So, we have some special tests how to assess the primitive reflexes. There are basically more than 7 reflexes, but we will be talking about the main reflexes in this webinar. So first is the motor reflex. I have put some pictures so that it is for better understanding what motor reflex is and how how we give the of the stimulus. So motor reflex is basically present at the time of birth. It is the fight and flight response. If there is any kind of sound or any stimulus, the child he opens his arms widely and legs as well. So the arms, upper limb and lower limb, it reflexes like this. The baby stretching out his arms with a scatter on suddenly being released for an instant. So this is how the child responses to that stimulus. Other than that, we have a rooting reflex. Okay, so after the motor reflex, the onset is for 28 weeks of gestation. Integration age is 2 to 5 months. But if the reflex is not been integrated, then there must be some issues in the concentration and attention, which the child may face early and later in his life. The next we will talking about the Gallant reflex. So Gallant reflex is very important. It is the movement of our spinal muscles. So if we put a stimulus, for example, you can see if I'll put my fingers around the lateral side of the muscle, then the child moves his arms towards the body towards the stimulus, like this in the next picture. So if this reflex is also being retained, then the child will face some issues, for example, like postural control, walking, and paying attention. So, all these issues he may face later in his life if this reflex has not been integrated at the time when it should get integrated. So next is the rooting reflex. Rooting reflex is that if you put the finger around the mouth of the child, then he will turn his head towards the stimulus. Where you are putting your finger, the child will open his mouth and turn around that side where you are putting your finger. So this reflex is very important. The child seeks for like breastfeeding and for sucking. This reflex is very important. If this is not retained, then the child must feel child must face some issues related to like oral issues and in speech and in placing the tongue and opening his mouth, and so all these issues may comes after if the reflex is not being integrated. So the palmar grasp reflex is if you'll put your finger or hand on the palm of the child, he will eventually flex his fingers and try to hold it. So this reflex is also gets retained after 3 months. But if gets retained, then the child will have difficulties with writing, pencil holding, and other issues related to the fine motors in the hand. The TLR, tonic labyrinth reflex, is that if the child is lying prone, then he will flex his arms and legs. And if the child is in the supine position, this is a supine position, then he will, the extensors will generate and he will extend his arm and the legs. ATNR is that if you will turn the head of the child, then he will flex his arms and extends his arms to the side of the face. And he will flex the arm of the skull side. Like this side, he will flex his arm, and on this side, he will extend his arm. So it is very important. It will promote eye and hand coordination. STNR, the onset is 4 to 6 months, and it get integrated by 8 to 12 months. This reflex is very important for crawling. If this reflex is not retained, that child will again have problems in eye and hand coordination. He will not be able to copy from the blackboard and write. The last we were talking about the Landor reflex. If you put the child in this position, he will extend his arms and legs as well. So these were the reflexes. I have just given you an overview what the reflex is, and I've shown you some pictures like how that reflex looks like. It is a very lengthy topic, which in future, if we will get a chance to like have this webinar again, then I will be explaining all the things like in a very proper way. So the next thing is that what to expect when a child starts occupational therapy. So first thing is that the therapist has to build a rapport with the child. The child is following the therapist. The child is able to do everything which the therapist is asking, and he is able to follow the command. And we work on necessary sensory integration according to the child's need. And we work on the retained primitive reflexes according to the child's need. And along with that, we work on name call response, eye contact, sitting tolerance, waiting time, attention span, command following, visual perceptual skills, muscle tone and posture, gross motor skills, and fine motor skills. Along with that, we will work on cognition, working memory, auditory processing, long term memory, visual processing, and age appropriate ADL. So, how the occupational therapist and therapy helps in the speech development. So regulation is the ability of the child's one's activity level of alertness. If the child is not alert or not getting the response from the environment, that he may not be able to produce sound, and because he is not aware about the body. So first thing is very important. The child has to learn body awareness, and he has to learn that how he should like use his oral muscles, how to place the tongue, how to place his muscles of lips, like while we are speaking, so we are making producing sound. So all these things comes under occupational therapy also, so that after learning this about the self awareness and body awareness, a child is able to produce sounds and able to make words as well. So the vestibular system is a complex sensory system integrating information from the vestibular organs. So the vestibular organ is actually like it is present in the ears, inner ear, the eyes, and the neck shoulder muscles. So if the child is able to balance and walk properly, that means the vestibular system is working properly. So simultaneously, after addressing with the occupational therapy, he may be able to produce sounds and like work with the speech therapist as well. Because speech is a complex motor task involving so many different muscles and body parts, it is important the entire body is addressed. Inadequate trunk control, instability at the shoulder girdle, or poor stability in the head, it can all negatively impact the speech production. The lip, tongue, jaw work most effectively when they are supported by a strong neck and trunk. Posture support also impacts a child's ability to use breath support to generate speech. Being able to maintain an upright posture is essential to speech production and swallowing. As child moves, sensory receptors located throughout the muscles and joints feed information to the brain about position, and his information plays an important role in planning movements for speech production. The coordination of our vestibular, visual, and auditory system is how we begin to understand the space and time. We use this knowledge for higher level of language skills like structure, sequencing, timing, and turn taking in conversation. So, this is also one of the question which I get from the parents, that is the child is showing behavior or he is feeling sensory overwhelmed. So we have to understand the difference of showing behavior and feeling sensory overwhelmed. Kids with sensory concerns behave differently from typical peers because their brain processing everything from the environment differently. While neurotypical, the usual way of processing information, children may show tantrum to get their way. Autistic children are more likely to have meltdowns or tantrums because either they are overwhelmed from a lot of sensory input or frustrated or unable to communicate their needs. So, a neurodivergent or neurotypical kid, they both behave differently. Autistic kids, it's very hard to understand because they show meltdown. They also get overwhelmed by the sensory input, or they are not able to communicate their needs, because communication is like one of the area which we have to work because they are not able to communicate. Other behavior differences may include having interest associated with people older or younger than them. For example, an autistic kid will feel more safe with a person. He may not feel safe or like that much comfort with another person also. So if he has to ask for to like express his needs, so he will go to that person only. Perseverating meaning that they say or do the same things over and over in exactly the same way, or get stuck on a thought, idea, interaction, or desire. For example, autistic kids, they have this habit of like doing having a pattern, a schedule. Like in the morning, they will wake up, they will do the same thing, and one by one, they have the same routine. If any of the routine gets changed, they may or they might feel they will show tantrums also, they will feel overwhelmed also. So if any of the pattern is disturbed, they will also feel disturbed, thriving on routines and getting very upset when normal routines are changed, becoming emotional or all over small things and having a lower tolerance for stress. Even a teen or adult may suddenly burst out crying or over a change in plans or a forgotten water bottle. In some cases, autistic children can be impulsive or self harming, or they may run away for reasons they are unable to express to their parents or peers. Now, the reason why we are having this webinar is to like get information and to teach you that stem cell therapy and occupational therapy is a very powerful combination when we both work together. So what it helps us, it maximizes recovery and quality of life. Stem cell therapy plus occupational therapy, it helps in regeneration, rehabilitation for better communication skills, reduced hyperactivity, and greater independence. Stem cell therapy benefits are it benefits in tissue regeneration, it replenish lost neurons and enhance neural connectivity. It reduces inflammation, prevent damage to neurons. Neuroprotection, it protects and promotes cell survival. It also helps to improve function. It boosts communication and social interaction. I have explained everything about occupational therapy and the benefits. So the benefits are functional rehabilitation, neuroplasticity, and muscle re-education, sensory integration, and holistic support. The combination works even better. The combined benefits are enhanced recovery. It addresses both physical repair and skill restoration. It helps in faster functional gains, quicker improvement in cognitive skills, and daily functions. It also increases independence, enables better self care, work, and leisure. Personalized treatment, OT adapts therapy to maximize the results of stem cell therapy. So while we were webinar, we have received a few questions from the parents and patients. So all these questions, my fellow member will be like answering the questions. Dr. Swati, I would like Dr. Swati to please introduce herself.
Hi, good evening, everyone. My name is Swati Sharma, and I have been associated with Advanced Cells for last 8 years. And I would like to invite everyone for their questions, and we both will try to answer them. So please go ahead. Hi, Twinkle. Is there any question in the inbox which we can answer?
Yeah, we are waiting for the questions. Meanwhile, Dr. Ishika was having some questions. So, Dr. Ishika, you can ask.
Okay. So thank you, Dr. Swati, to introduce yourself. The first question which we received is, what are stem cells and how do they work?
So, thank you for the question, Dr. Ishika. So, basically, stem cells are regenerative in nature. They can get converted into another type of cells. So, this is the property basically which we are using for the conditions where there is no first line of treatment and no clear cut treatment is available. So, there can be various sources of these stem cells, but when we are specifically talking about autism, where kids are involved, so we prefer to take cells from the umbilical cord. In adult patients, we can take cells from the patient's body as well. That is called autologous transplant. In that case, we can take bone marrow, fat tissue, and different sources are available. But when it comes to typically to the kids, in that case, we take cells from the umbilical cord, and these are called mesenchymal stem cells. So basically, theoretically, the line of action is where as soon as you give the cells will go into the body. They will create their place wherever they need to go. They will do the homing. They will start dividing and increasing their number inside the body, and they will start repairing and replacing the old damaged cells. So this is the theoretical part of it. Along, and we are giving these stem cells along with exosomes. So what exosomes are basically secretome of these stem cells. So when we are culturing these stem cells into the laboratory, And they're multiplying in the number. So that time exosomes are being secreted by these stem cells itself. So they are not regenerative, but they're carrying the same language which stem cells are having. So when in the combination going into the body, so these exosomes will be creating right environment for these stem cells to go and start functioning over there. So this is how in the combination they work very well for the patients. And if I elaborate more, so there can be multiple route of intervention like intravenous, lumbar puncture. If you are giving into the eye, then it can be retrobulbar. If you are giving site specific for ortho condition, you can give it into the knee joint. So there are the usage is vast when it comes to administration of stem cells.
Okay. The next question is, what is the treatment protocol? How long does the
Mhm.
procedure take? Does the child need to be admitted in the hospital for the therapy?
Mhm. So basically, the treatment protocol is very, very simple. It's a daycare procedure. The patient does not have to stay in the hospital. And when it comes to kids, minimum exposure to any of the infections. So it's a daycare procedure. It will take 3 to 4 hours in the hospital. And route of intervention, as I said, IV and lumbar puncture. IV is intravenous, if anybody wants to know. The injection which we give through the vein, जैसे normal glucose दिया जाता है, बिल्कुल वैसे ही देते हैं. Lumbar puncture is into the spinal cord. So very easy procedure. It will be done within 1 hour only. Then patient will be under observation, and after 3 to 4 hours, we can discharge the patient.
Okay.
Yeah.
So, what is the success rate of stem cell therapy for children with autism?
Okay. So this question is very subjective, Dr. Ishika, because I would like to be very clear with everyone on this point, and it is important for everyone to know about this. That stem cell therapy is in an experimental phase. This is not an approved form of therapy where we can claim and say that you take the therapy and the child will be 100% fine and the diagnosis will be cured 100%. So that is not the case. The improvement is subjective. So the patients who have already taken treatment from our lab, see how we work, because Advanced Cells is a manufacturing lab. We are into research and manufacturing of stem cells. So the parents and the doctors who are reaching out to us for the cells, we provide them stem cells and then they can go ahead with the therapy. But of course, we help them with doing the entire procedure as in when it is required. So success rate exponentially. Parents have seen improvement as far as speech is concerned, social interaction, eye contact, sitting tolerance, hyperactivity. So these are the areas where parents have noticed significant change.
Okay. Can stem cells improve a child's speech, social skills, communication, learning ability, hyperactivity, and all such observations?
Yeah, so this is what I have just mentioned. These are the areas where parents have noticed the improvement. The level of improvement may vary depending on how the patient is in general and naturally. Some patients are very good at grasping new things, and few will take up new things little slowly. So it totally depends. But yes, improvement has seen in these areas.
Okay.
Um,
Can I ask a
Mr.
question?
Kundan? Yes,
Um,
you can.
yeah, so you mentioned that you use either IV or lumbar puncture for to inject the stem cells in the child. Do you
That's
do both?
correct.
One of those during the
Mhm.
therapy?
So, sir, we recommend, I mean, our doctor recommends both IV and lumbar puncture. But I mean, if the parents are interested to go ahead only one route of intervention, that is also possible.
Yep. Okay. So I have a second question as well. Um, so stem cell therapy is a medical procedure, right?
Mhm.
So you inject the stem cells into the child, and then they go into the certain area, they repair, they do whatever they need to do. Um, why do we need the occupational therapy along with the stem cell therapy?
So, thank you for your question, sir. As Dr. Ishika have just about a very specific quality of our brain, which is neuroplasticity. So, what neuroplasticity means, if you are learning something new and you are practicing it for a certain period of time, then it becomes your second nature. It becomes your habit. So, in autistic kids, what happens? Certain activities, behavioral issues are there, and the patient is not able to perform certain activities. Suppose speech is not there, or the patient is not able to do basic things. So, what happens when you're giving stem cells? So, these cells and exosomes are working internally that will accelerate the entire procedure of learning. And when through occupational therapy we are putting efforts from outside, so training plus regenerative medicine works very well for the patients. So the combination works very well in that case. So here we are leveraging the quality of the brain, which is neuroplasticity.
Yeah.
Yes, it's very important to continue occupational therapy as well, because the child has to learn ADL, because he has to gain independence. The combination will increase the like recovery rate, and the rate like usually the child is facing some delays. So the combination, it will help to boost the treatment.
Yeah, because if we are just giving stem cells and expecting that everything will start getting better just by giving stem cells, so that is not the case. We have to push the child, and that push comes from these alternative training therapies.
And how long and how frequent these occupational therapies need to be taken
So
after?
initially, when the patient has just started taking the therapy, so you may need for a longer duration, like for a year or for 2 years. Then, depending on the improvement and how the patient is responding to everything, we can decide. I mean, just with one session or two session, that will be a assessment time only. So that will be too early to decide about for how long patient should take the therapy. But initially, yes, 2 years time is important. Am I right, Dr. Ishika?
Yes,
And it's every day or once a week?
It's an
that
everyday
depends.
process, sir. Yeah.
Yes,
So occupational
also
therapy
it
every
depends
day
upon the
after
child's
the
need.
stem cell therapy. Is that right? So
So could you please repeat?
do the child need occupational therapy every day after the stem cell therapy for 1 year? Is that right?
Sir, see, thing is that the
Child,
other day, yeah, please go ahead, Dr. Ishika.
yeah, you are saying that if the child will require occupational therapy every day or not, that depends upon the child's need. In the first slide, I have mentioned about the evaluation, in which we evaluate the child's need. Everything we like get the information, and then we work upon that. We make a protocol that this child, the child is facing these problems, these are the areas to work on. Then according to that, we plan our treatment. So whether the child requires 3 days a week, every day, so it depends on every child. We cannot say that every day's requirement, or thrice a day, or like once a week. So it depends.
Okay. So practically, some of the people are obviously not from Delhi. Like I'm from Punjab, and I will be um, traveling to Delhi for my child's treatment if I choose to do that. Um, how do we take the occupational therapist while still living in my hometown, and how does this work?
You can
So,
also have online consultation, like video consultation is also available in some areas, and we can have a follow up, like you can visit the hospital or the center once or twice a week. You the therapist can teach you some strategies to perform at home. The therapist can give you like home programs, like these are the areas to work on. You have to do these activities at home, so you just perform all those areas at home, and then you visit the OT center for like to get the information that if you are performing it correctly or not, and what is the progress and everything. So like you can like get occupational therapy that as well.
Yeah. Okay.
Yeah.
Thank you.
Hi,
So can we
Dr.
move forward to the
Doctor.
next question?
Yeah, I have
Sorry.
a question. Uh,
Yes.
my voice is audible?
um I'm sorry, I'm not able to hear you.
Okay, okay. Let me get my earphones. Yeah, is my voice audible?
yes.
Yeah, so I have a question for my child. He is suffering from some disease. So I want to know, how do occupational therapy help in speech production? Like, is it beneficial?
Can you please repeat your question?
My question is, how do occupational therapy help in speech production?
Okay. In speech production, as I've mentioned, the body awareness. If he's not aware about himself, like if you just keep talking to a child, like, hi, hello, how are you? He's not processing it. He's not getting the information in his head.
Yeah,
So, like, occupational therapy helps. First, we like evaluate every areas, his sensory, his visual area, his auditory area, his vestibular area as well. So when the child develops the self-awareness and he is able to like coordinate with all the muscles and movements in his body, then the child is able to produce sound, and he is able to speak. Then the speech therapist will help him to produce sounds and how to like work with auditory memory also. So that is how the occupational therapy helps with the speech production. So before the speech production, these areas are very important to work on. All the sensory areas are very important to work on.
for that I have to take the first consultation, or how would I test that these things will work?
How the test?
Yeah, can I do some tests so that I can know that my child will be in good condition after the therapy, or he how will I know if he will progress?
You will see the results. That's how you will get to know that if you get treatment, you will be regular with the therapy sessions. Then eventually, by 3 to 6 months, results are very much visible.
Okay, thank you.
Okay, can we move forward to the next question?
Yeah,
Yes,
Dr.
please.
Ishika, please.
So, how do you decide if the child is eligible for cell therapy or not? What are the eligible criteria?
So basically, I mean, age group will play a very, very important role when we are selecting the case. So generally, we say sooner is better because when the child is growing, there is still a scope to see more improvement in the patient. So, so the age group of 3 to 5 is good, but there are parents who are approaching us with the age group of 10 to 15. We can still try in those kids as well, but the improvement will be noticeably slower as compared to a child at the age group of 3 to 5. So at the time of selection, we have to see many things, that the patient is not having any current infection. There is no chest blockage. There is no infection, no fever. If the child is free from all these things, then we can go ahead with the therapy. Of course, during the consultation and the counseling, all the history of the patient will be taken, medical reports will be reviewed. And before coming, also, our team will ask about all these documents, and then accordingly we will fix up for future appointments.
Okay.
Yeah.
So, can stem cell therapy be taken
Mhm.
along the other treatments like occupational therapy, ABA, speech, and so on? Like this question also, we have we had this
Yeah,
question.
I think we have already covered this question
Like,
one way or the other when I was talking about the neuroplasticity. So the combination works really well. So even if the patient is taking only occupational therapy, only speech therapy, so just to accelerate the results, to see the better outcome, stem cells can definitely be tried.
okay. Are there any case studies, results, or testimonials from other parents who have taken stem cells for occupational therapy? Can you please
Mhm.
talk to some other parents who have taken the procedure?
Twinkle, could you please share the link? So Twinkle has already shared the link of testimonials and the results shared by the patient itself. So anybody who wants to see the results and what the parents are feeling after the therapy, so they can just go through the link. And yes, they can talk to other parents as well. But we have a policy. We need to take the consent of the existing parents. If they agree, then definitely we can arrange a con call, or we can arrange a Zoom call. So that's how they can connect with the parents. Dr. Ishika, I'm done. Hello.
Yes.
Yeah, Dr. Ishika, I'm done with the answer.
Okay.
Yeah.
Are the results that come from stem cell for permanent or temporary? Are there any changes or restrictions in diet, lifestyle, or activities of the child after treatment? If yes, please suggest.
See, as far as results are concerned, we have not noticed anybody to say that there is any regression after stem cell therapy and occupational therapy. So, again, when we are talking about the neuroplasticity of the brain, so whatever the new has been learned by the child, so that stays. And of course, the regular practice and intervention of different therapies will be required, as in when the child is getting hyperactive or any specific behavior is coming up again. So these alternative therapies will be required. But till now, experientially, whatever gain the patient has achieved after stem cell and occupational therapies, that stays. As far as diet is concerned, diet will play a very, very important role in autism. So generally, they say you can casein free, gluten free. I mean, those type of different diets are available in the market, which you can definitely follow. But what we believe, when you are in a family, so it becomes very difficult for everyone to maintain with such a strict diet structure. So we recommend whatever you're cooking at home, just give that to the child, but the portion of each element can be different. Just give more protein, more fiber, less carbohydrate, and very less sugar. Because if you'll stop sugar, you'll stop carbohydrate, you will give one specific type of diet to the patient. In that case, the micronutrients will get deficit in the body. So it's better. See, every patient is different. If the patient is having a specific gut problem and allergic to something, then you have to definitely stop that. If the patient is gluten intolerant or lactose intolerant, then of course in that case you have to stop the milk. But our recommendation generally is the child should be given diet which you are having at home regularly, but the portion of the elements has to be monitored and it has to be given in a very specific conscious way.
Okay.
Yeah.
So, how important is choosing the right cells for the treatment?
See, it is actually very important. If we talk about stem cell therapy, so patients are not generally coming for any facility. They are not coming for the doctor. They are coming for the product. So it is very important for the patient to have a right quality cell, which are well checked in the laboratory. The I mean, quantitative, qualitative analysis is being done nicely. Only then it is being administered to the patient's body. So if I talk about advanced cells, we are expert in producing different cell lines, different type of cells. So they are well qualified inside the laboratory. At the time of dispatch from the laboratory, so the viability of the cells is 98%. All the certificate of analysis is being provided along with the cells. The our laboratory is ISO and GMP certified. So these are the criterias which you need to check before you are going ahead or selecting any laboratory to procure the cells. So with advanced cells, these possibilities are there. I mean, we are very good in this.
Okay. So, are the stem cells safe to use, or are there any concerns related to them?
See, I mean, it's a good question in a way, because when you go to Google, will give a lot of information about stem cells. It will talk about tumorigenicity. It will talk about any secondary side effect to the patient's body. Yes, I mean those questions will rise in mind when you don't know somebody, or you don't have a right information. So the cells which we are giving, they are having a lifespan. If you are taking cells from, let's say, from the embryo, which is called embryonic stem cell. So in those cells, what happens? There is no stoppage on the growth. So that can be a reason of creating any tumor in the body or causing any secondary side effect into the body. But when we are talking about mesenchymal stem cells and exosomes for that matter, they have a lifespan. So after finishing their work inside the body, start depleting in the number. So whenever the patient asks me, ma'am, when I can come for second round of treatment, so generally I say 8 to 12 months, because that is the time. In that duration, the cells are still working in the body, they're still producing cytokines, growth hormones, and growth factors. So I mean, they're absolutely safe, they're well validated inside the laboratory, only then they are being given to the patients for any therapeutic purpose.
Does any adult carry this disorder like other children's?